Thank you, Mr. Speaker. Our kids, our seniors, and constituents deserve to live healthy, prosperous, and independent lives. And that's why I spoke with hundreds of my constituents at a Medicaid town hall this past weekend, because most of them depend on Medicaid to live fulfilling lives with dignity. The impacts of the $880 billion in cuts being proposed to Medicaid are not statistics. They are children, parents, educators, and grandparents. They are neighbors, our friends. I heard from a father whose son was almost institutionalized. He was getting ready to quit his job to take care of his son full time. Instead, his son got access to care through Medicaid, which allowed him to continue running his nonprofit, helping adults with intellectual disabilities. And I listened to a grandparent of two intellectually disabled kids who has been their legal guardian for 15 years now. And with the help of Medicaid, both children are now living independently. But with these cuts, they may face medication bills of $7,000 per month and be forced to move back in with their grandparents. And I heard a nurse who shared that around 40% of the births in her hospital are covered by Medicaid, including prenatal, maternal, and postpartum care. That's what supporting families and family values looks like. And a speech-language pathologist at a Title I school who told me that most of her students are on Medicaid. They rely on it for free and reduced school lunches, and students with disabilities rely on it for their education. Let's look at the facts. Medicaid supports 1.8 million Virginians, and many of them, hundreds of thousands of them, would lose their Medicaid access because 1% cut by federal government contribution to Virginia's Medicaid program will mean everyone from Medicaid expansion loses their Medicaid. And so 3 in 10 children are on Medicaid, 2 in 7 working age adults with disabilities are on Medicaid, and 5 in 8 nursing home residents are on Medicaid. And Medicaid is also the 4th largest federal funding source of our public schools. It provides mental health services, it ensures kids with disabilities get what they need, and in 43 states, including Virginia, it provides access to free and reduced price school meals, too. There are over 37 million children enrolled in Medicaid and the Children's Health Insurance Program, or CHIP, in the United States. These are the most vulnerable people in the country that stand to lose the most from these deep funding cuts. And if we want to talk about fiscal responsibility, cuts to Medicaid will mean less preventative care, more costly emergency room visits, and more higher costs treating preventable diseases and illnesses. That will increase premiums and costs for every single American, even those with private insurance, those who are not on Medicaid. Everyone will be affected by these cuts. And yet we hear that these cuts won't touch Medicaid, but that's not true. Just look at the math. It's the only way to make these cuts. Medicaid is a lifeline. It is not a line item that can be blindly chopped to pay for a partisan wish list of bad ideas and tax cuts for the biggest corporations. In the richest country in the world, we should be working to cure diseases and explore new medical technologies and expanding Medicaid, not cutting off basic care. Our kids, our seniors, our communities deserve better. I yield back.